Airports and train stations on high alert across China. This after authorities revealed the coronavirus can be spread between humans, something they had previously ruled out. Officials there say vigilance is key to stopping the spread.
I think the outbreak is in its early stage in Wuhan. Though there have been more than 100 cases, this is a small number compared to the population of Wuhan, which is more than 10 million. But we need to be on high alert. The outbreak can be totally reversed if measures are taken now.
Health authorities believe the virus originated at this now closed market in Wuhan, which sold fish and wild animals. The outbreak coincides with the Lunar New Year holiday, the busiest travel time in China. On the streets, concern is growing.
Of course I'm worried. I just went to buy masks. I tried buying masks around my neighborhood before leaving, but they were all sold out. I'm worried because so many people will be traveling.
Honestly, I have no idea which reports to believe. I just trust my instincts. I'm not that confident that authorities have the situation under control. I think the number of infected could be far more than reported.
Of course I'm worried, and the virus could spread rapidly. If cross-infection happens during this travel period, the epidemic will be terrible.
Other countries, including Australia, are also implementing enhanced screening measures. Authorities there say they are monitoring a possible case of the virus. The World Health Organization will meet on Wednesday to decide if the outbreak should be declared an international public health emergency.
Joining me now is DW science correspondent Derek Williams. Welcome, Derek. Within the space of the last few weeks, we have 300 people who are infected with this virus. 6 people have died. How dangerous is this new coronavirus?
Well, the coronaviruses belong to a group of viruses that up until now, around 7 different strains have been identified that infect human beings. And they range from things that cause symptoms like the common cold to SARS or MERS, which are actually quite deadly diseases. I mean, MERS kills more than 30% of the people who contract it. SARS kills about 10% of the people who contract it. So far, this disease doesn't appear to be nearly that lethal, not that deadly. The numbers of people who have died is keeping within a fairly small group, and if people don't have compromised immune systems, it appears to not affect them too badly. So how deadly is it? It is, or can be deadly in its current form. How deadly could it become? That's another question entirely.
Now, it's already spread to 3 other Asian countries, and 2 other countries, Australia and the Philippines, are looking at patients with these flu-like symptoms. What more can you tell us about these cases?
Well, most of these cases, all of these cases actually originated with people who apparently contracted the disease in Wuhan. So they've flown on to those countries from that epicenter, if you will, of the current outbreak. Now, in Wuhan, it appears that it came from a market that sold seafood and also wild animals within the city. Now, wild animals often serve as reservoirs for these kinds of viruses, which can then, if they're in close contact with human beings, can also leap what's called the species barrier and mutate into viruses like this one that we're apparently seeing right now.
Now, how well prepared is China to contain this virus? Because as we know, the Lunar Year holiday is starting and millions of Chinese are on the move.
Well, it probably actually couldn't have happened at a worse time. But on the other hand, China seems to have understood the message that it needs to be transparent. Now, back in 2002, 2003, with the SARS outbreak, that was one of the biggest problems. China tried to cover up the fact that this epidemic was going on, and that just made things worse because in the modern world, obviously, people are moving, they're crossing international borders. We have to be transparent in outbreak kinds of situations like this so that we know where things are starting and where we need to put measures in place to make sure that they don't spread further.
Now, the SARS epidemic that you mentioned killed 600 people. Does this new coronavirus have the same kind of potential?
When you're talking about viruses, potential is kind of a tricky word because viruses can also mutate quite rapidly. So could it become deadly? Yes. But is it deadly now? No, it appears not. And it never has to become that way. Really, the coming days and months are going to be critical. These kinds of outbreaks, they don't start overnight and they don't end overnight. We're going to have to wait and see whether the measures that are now in place are able to contain it. And we've come a very, very long way since the SARS epidemic of 2002, 2003. And the question is have we come far enough?
Right, we'll have to wait and see. Derek Williams from DW's Science Desk, thank you very much.